Ladies and gentlemen, we have a quorum. Jody has taken the roll. I'm going to go ahead and open this thing up. The weather's horrible. Let's get this done and get on with it. I'll read the emergency evacuation. In the event of an emergency evacuation, an alarm will sound. Everyone should exit the building by way of the nearest stairwell in a safe and effective manner. If the nearest stairwell is blocked by smoke, please use the other stairwell. Do not use the elevators. Once you have reached the main floor, follow the exit signs to exit the building and quickly proceed away from the building. Please be mindful of others evacuating and of emergency vehicles. Anyone here wish to speak to items on the agenda? I see none. Stand for a motion to approve the minutes of November 26th. Mr. Lale, second Mr. French. All in favor signify by saying aye. Aye. Opposed, say nay. Now, guys, what Jody has included for you on item number 3 is the changes, correct me if I'm wrong, please. The changes that will be made in the employee handbook. She has one entire handbook printed out if you would like to see it. I told her it really wasn't necessary to print out an entire handbook for each one of us for tonight, because what we're forwarding to the full commission to approve are the changes, and of course we will forward the entire handbook on to the full commission. But if you look at the changes there, and I will stand for a motion to forward this on to the full commission for approval.
So moved.
Pick one. Second, pick another one. I think Ms. Crisp did that one. Any questions on what the changes are?
Can we access those online just in case we need it?
You sure can. The whole entire handbook right now is online. I have not put the correction one on there yet because it has not been adopted by full commission.
So the changes are not online?
No.
No, sir.
Are the changes in that one?
Yes.
Okay.
If you'd like to see it, it'll be laying on my desk.
I just tried to save a tree or two, Mr. French. I just didn't think it was necessary for her to make 12 full new copies.
It is. It basically is. Just cleaning it up, you know, for the 2013 year and things like that, yes.
Jody, I did have a question about the sick leave accrual, because we don't, in the school system, we don't allow people to take sick leave as they roll out of the system. So can you address the backstory on that, or why you all chose to do that?
I'm turning you on.
Just for my purposes, in case something like that comes down the road for the school system.
Sure. It has been our practice years past, since I've been in HR, that it's always been in our summary plan book. It has never been in our employee handbook. That any employee that has met retirement qualifications, that they could, that they have 30 sick days built up, that they could be paid out for it. Don and I discussed this. He actually took it to the mayor. The mayor thought it would be a great, incentive for that retirement person, because they've been here 30 years, and that type of stuff or more. Okay. And if they have that time built up, that is a great incentive to give them at least 30 days of their paid sick time. The remaining sick time, of course, will go towards your TCRS or additional retirement credit.
Okay, so that's only retirement. I did see retirement there.
Yes, only retirement, yes, at retirement time.
You confused me there.
What's that?
You confused me for a second.
Yeah.
It's retirement.
Right.
Okay.
Thank you. I appreciate that.
No problem.
Anything else? Any other questions? All those in favor, please signify by saying aye. Aye. Opposed, say nay. Forward that on. Now, rates for budget purposes.
You will be taking it to the commission?
It will be going to the full commission in February.
Okay.
Yes, it will go on the agenda committee February the 6th or whatever it is, and then the full commission at the February commission meeting.
Thank you. Thank you.
Okay, now the rates.
Yes.
You're still turned down. If you will go over that for us, please, ma'am.
I will. In regards to the insurance rates, under the guidelines of the committee, in past, you all have asked that any insurance rates, approvals, inquiries, and things like that go through this committee before going to full commission. What I have done, Ginger has sent me all the information in regards to how it's laid out right now for budget purposes. And so we just want to make this guideline, correct under the HR committee's wishes, that these are correct and true for 2013. I have asked Drew Mann to go ahead and get us a projected rate for the medical and dental for the 2014 portion of the budget year. And hopefully that he's going to have that to me by the end of the month, so I can at least give to county so they can have something to start the budget purposes on.
And Ms. King,
Yes.
on the information showing before you, are there any changes reflected from the previous year?
Yes.
Would you please state what those are?
The only change is on the dental that I am aware of. The dental for number 3, employee-provided dental insurance for full-time employees only. Per full-time employee with no dependent coverage monthly, through Blue Cross Blue Shield, they are billing us $22.07 per employee, $68.30 for family coverage. To keep budget, and Ginger, correct me please if I'm wrong, to keep budget purposes correct and going within the guidelines of what they are billing us for, the recommendation is changing it to the 2207, because right now I think you're being budgeted for 25 per employee, because you're not paying out of your budget any dependent coverage under the dental plan. That actually comes out of the employee's pocket for dependent coverage on dental. So that will be a decrease from the 25 to 2207.
But it is a supplemental. It is not paid by departments.
No, the 2207 is.
is paid by the departments, that's the employer cost.
Yes.
Okay, beg your pardon.
Yeah.
But it's still supplemental.
Yeah.
The employee can choose to be on the dental plan, it's a voluntary.
Voluntary, okay,
Yes.
okay.
What was it for family?
Family coverage under Blue Cross Blue Shield is $68.30.
Maybe by the employee, you said, by the employee.
The $44, right now, what is coming out of an employee's pocket to pay for dependent coverage is $44.
Mr. Mann, anything you would like to add to this?
No, not on this. I would like one moment just to mention something about claims at some point. I may have should have raised my hand earlier.
Yeah, we'll get to that just as soon as we get over the items on the agenda.
Jody, there was a
Yes.
change also from the, the life insurance one.
Oh.
It's also a reduction too.
It was, I'm sorry, yes, that is correct. That was actually, when we went to Humana, the life insurance did decrease, and that was in 2011. When we were with US Able, it was 23 cents, I think, per employee on the life insurance with AD&D coverage, and now it's 22 cents. So that did change in 2011, yes.
So in essence, do we have to forward this to the full commission?
Under your guidelines, yes,
Under our
sir.
guidelines, we'll forward this to the full commission for approval and setting, and in essence, what we're forwarding, items 3 and 4 are decreases from the previous year.
Yes.
You decrease from 25 to 2207. You decrease from 23 to 22. We good?
Not sure what you're looking at me.
Motion forward on. We got a, we haven't done a motion on
I'll
this
make a
one yet.
motion to forward it on.
Motion from Mayor, second from Mr. Lael. Anything else? All those in favor signify by saying aye. Aye. Opposed, say nay. We'll forward this on.
Thank you.
Now, items not on the agenda. Now, Mr. Mann, your time in the barrel.
I'm going to be very quick. Thank you, guys. First of all, I want to apologize to the committee for last meeting. I was planning on showing up the next night and would have been the only one here, and Jody informed me, and somehow I missed it and just had a brain lapse, so I apologize to you guys. I just want to mention to the committee, I've been meeting with you guys now for 4 or 5 years, and you guys have had a pretty good run as far as health claims are concerned. This first 6 months of this year, July through the end of December, have been very difficult in terms of the amount of claims for the county. November specifically was we've been running $1 million in claims a month roughly is the number that I expect to see. I mean, that's sort of, I see $1,001,950, I look at it. Well, we had 1.5 million in November. We've had 2 claimants exceed $280,000 since July. While that doesn't necessarily, those 2 numbers aren't surprising. What's surprising is that they've happened so early in the plan year. And so what's happened is you guys have really you've had to pay all that money out until reinsurance kicked in. So again, as an eternal optimist, I'd like to think that over the course of the next 6 months, we're going to track how we typically run. There are no guarantees for that. This is the first time that you guys have run in a deficit. We're $1 million under through the first 6 months what we've collected, not only from the employees portion but from the county funding. Now again, it's too early to make a snap judgment, but I'm not doing my job if I don't let the committee know. And I'm sure you guys are aware. I mean, you guys see the fund balances. But November was difficult, and it's a result of 2 significant claims. And you've heard me say over the years, this is all about large claimants. And we had 2 bad ones. And those are now in reinsurance, meaning if those individuals have any more claims, the county won't incur those costs. But that's not to say that there are some other things out there. So really, that's the only thing. The other thing I do want to say to you is the reinsurance renewal, depending on if the health of these 2 individuals continues to decline, they could be a difficult reinsurance renewal because those folks nobody wants to insure a burning building. And those you have 2 claimants that hit $300,000 in effectively less than 4 months because of the lag time. That's pretty significant. So that's really all I had to say, Gary, unless anybody had any questions for me.
And then, of course, you will be advised by Ms. King of the April meeting, and that's when we will have to take your numbers. So
Yes, sir.
And when you provide them to us, then if you could give us a little advance time so we can go over those prior to
Yes,
coming
sir.
in here then.
Yes, sir. Thank you, guys.
Any questions out of anyone?
Are you working with Randy on this?
I am. Randy and Don called me in just before Christmas and sat down and asked if I would just kind of go back over some things that I had done in the past and do some analysis for you guys, especially in light of this first 6 months. Health insurance is never a problem when it's running below what we expect. But as I said, this is the first year you guys are in a deficit situation. Good news is you have a rainy day fund, and you guys haven't spent all that. But the reality is it's going up for everybody. It's not just Blount County. I mean, I'm sure, healthcare reform did not fix health insurance premiums. Let me be very clear about that. And so we're seeing it go up at every employer, and you guys just had a bad 6 months. So hopefully that'll turn around. But if it won't, I'll show you what the numbers are. So yes, sir, we have. Thank you.
Anything else? Everybody else good?
Are we on items not on the agenda?
Items not on the agenda? Yes, sir. Hit your button there and it'll turn you
All
on.
right. I would just like to say, in light of the last meeting we had where we looked at the clinic situation over there, is there anything to report? I know I've had a couple of not so good reports, and then I've had a couple that indicated some progress. Does anybody else have anything that they would like to share with this committee? Because I think we need to stay on top of it and monitor it.
If it's all right with you guys, I'm going to recognize Mr. Carver. I will elaborate just a little bit. There have been reports to the gentleman who was introduced to us, and I'm going to let Mr. Carver answer this now.
Good enough.
And I did ask permission if I could speak to you and get some points of what they were addressing. So this was a letter that was sent to the mayor. There is an additional hiring of physicians. They're interviewing 4 primary care physicians at this time. This letter was sent out last week, within the past 3 weeks, with the potential of hiring 2 more providers to the clinic. There has been an additional provider added on weekends to the clinic, so hopefully that's going to help a little bit in getting more providers to see those patients faster. At the registration, right now we're having engineers, workflow engineers look at it, architects to reconfigure how we're going to bring people in, process those patients that need to be seen, and help to move that flow faster. Customer service, there was some statements made that maybe some of the people checking in weren't quite as polite to cordial, thank you. I'm trying to think of the proper word. So what we've hired are consultants with Disney to aid in customer service and talking about how to process a patient in, address them and looking at their needs so much as not being maybe a little bit of overwhelmed with everybody coming in and trying to be able to control their emotions so much whenever they're seeing all this happening. Support staff, there's been 2 more registration staff already hired to help increase to assist with the increase of volumes of people coming into the clinic. Exam rooms, we've increased our exam rooms by 3 in the day clinic by being able to move one of the physicians up into the specialty area. So we've opened that up, and we're also looking at with engineers and architects to evaluate further expansions if we need to do that. So these are things that are being addressed at this very moment. I will let you know that from last year to this year, there's been it's 26 times more flu cases reported. So we've had kind of like the perfect storm. ETMG, we're putting in new software that was mandated by the federal government with the new Health Care Act. So that slowed us down. There were some things that had to be put in manually. The acquisition with Blount Memorial Hospital, that was an issue, just trying to get that transition of personnel. And then also with the flu cases, again, up 26%. And this is from the ABC News from Vanderbilt. Dr. William, I think it's Schaffner, and he's with preventive medicine at Vanderbilt, reported that in the United States that there's been a 26% increase. And we are looking at this region as being one of the highest, the southeast, of seeing flu cases coming in. So you've got a question, I think. So, but we are addressing it, and I asked him if I could come and speak just on what I know is going on right now, and not so much about that. And we are sorry that there has been some hiccups, but I think we're starting to see it turn around a little bit. And I don't know if you've seen that also, if there's been positives or negatives. I know there's been some negatives that I've heard of, and hopefully you've seen some positives with that too.
So Rick, what you're saying is that they're studying changing the physical plant as needed, adding personnel, and training and retraining their staff over there.
If there were some people that I heard was fairly rude on some statements that were made.
That was one of my main concerns, was some of the attitudes we were getting reports of. That, for example, this one lady went in and said, I've been waiting here 3 hours and you let X number of people in ahead of me, and the response to her was, well, you can't prove it.
You can't what?
You can't prove it.
Oh, yeah.
I mean, just...
Yeah, that would be inappropriate.
In most cases, this happened to be a very nice lady, or if it had been somebody like me, I would have probably had a scene, because that's just totally rude, unprofessional and everything.
It is, and unfortunately, some people...
And it does happen, I know.
They don't...
It's just the wrong time for that to happen.
Sometimes they don't handle it whenever the stress starts building up on them. But we did hear some negative statements that were made in regards to how people were being addressed when they had concerns about the time being
Right.
taken up.
If all the steps, well, not if, but the steps you are describing, as those take place, they will, and they should make, a positive impact. And that's all we can ask, is that they make a positive, concerted effort to do this. And I think it would be fair for us to stay in our monitoring mode and then see how it goes, so that when the time comes in June, July, whenever, then we'll have an adequate picture to make a fair decision.
Yeah. At the hospital, I'll let you know that there's patients that are in the emergency room because there's no rooms. And they're housing them there because of the flu epidemic that's happening right now. So
There's all kinds of factors that you have to take into account. But as long as an effort is being made, and this indicates that it is. And I was really concerned with the attitude, because a lot of times the people on the front will reflect kind of what's the policy, if you know what I'm saying. And I was thinking, if our business meant no more to them than that, then we shouldn't, be concerned about doing business with them.
yeah, I can understand
Again.
it. I mean, I'm on a angry response team. If there's a patient that gets upset, so I'm one of those that have to respond. And I saw one of our nurses not trying to talk to the patient, just argue with the patient. And we were able to
Right.
bring him out of the situation and talk to him and understood his situation. And they're just, I
And
don't
like
know
I
how
said, there's
people
always
handle
two
things.
sides to the story. We just, but I think it's kind of behooves this committee to monitor this pretty actively as we go through, and because I know Phyllis hears about it, and I hear about it, and I'm sure David probably does from some of his folks, and the mayor does, and so just stay in an active monitoring mode and let the decision be driven by what we have as a big picture.
well, the customer service training is taking place over the next 6 months. So again, we did hire the consultants to bring that in, started talking to people or training people on how to move that process
Right,
through.
and sometimes even just knowing there's an importance there takes care of the attitude adjustment,
Yeah. And,
But we could talk about it all day.
but hopefully with these additional changes that we're making, that will make it a smoother process to bring the county employees in and process them through. So thank you very much for letting me have this opportunity. Is there any other questions?
Thank you
Rick.
for the information.
Rick, I'd like
Miss
to-
Chris.
What, I'm sorry.
I'd just like to say, when I brought my grandson in, excellent treatment. They had the ladies sitting there with the table set up,
Yeah.
helping get people checked in and stuff. And I think it was about 30 minutes that I had to wait, and then we took back to the room, and everything was positive on my note. But some still are having to wait the 3 hours, and the big thing is they're wondering why they sit out there for 3 hours and only are in the back 5 minutes.
Right.
So I think that's a big concern.
And I'll-
What's transpiring,
And I've even asked that too. I've gone in the back where the nurses are to see the patients coming through with their charts. It's a good question, and I will bring that back to them. What is it that they're waiting so long to be seen for just a short amount of time? And then, but I know it's being addressed, and hopefully that you'll see that when you go there, that's being addressed too. So it is a major effort that we're trying to address for you. So
Thank you, sir.
thank you.
I see no additional lights. Anyone have anything else? Not on the agenda. Seeing no lights, seeing nothing on, stand for motion to adjourn. All in favor say aye. Aye. Ladies and gentlemen, thank you so much for enduring this weather.